Welcome to The Explainer. Today, we're unpacking a massive medical paradigm shift based on some really eye-opening insights from Everblink Health Care. We're talking about something that fundamentally changes how we view one of the most widely discussed, yet honestly frequently misunderstood conditions in women's health. We are moving way, way beyond the traditional understanding of PCOS.
So think about this for a second. What if one of the most common hormonal disorders out there was never really just an ovarian condition? For decades, medicine has framed this purely as a reproductive issue. But what if the ovaries are actually just the victims of a much larger systemic breakdown? Today, we're challenging those old assumptions to see how this condition extends far beyond just reproductive health.
There is a vital clinical correction happening right now in the medical world, and it starts with the name itself. We're moving away from PCOS, Polycystic Ovary Syndrome, and shifting toward PMOS, which stands for Polyendocrine Metabolic Ovarian Syndrome. Notice how cystic is dropped entirely in favor of polyendocrine and metabolic. And this isn't just some PR rebranding exercise. It perfectly captures the complex whole-body changes that are actually happening inside the patient.
Honestly, the old label PCOS has some severe limitations. First off, and this is incredibly frustrating for patients, many individuals diagnosed with it don't even have ovarian cysts. Add to that, the symptom patterns vary wildly from person to person. But the most glaring oversight is that the most severe complications are actually metabolic, carrying multi-organ health risks. Think of the thousands of patients who were told they didn't fit the traditional mold because they lacked cysts, yet they were still dealing with severe systemic issues. The old label accidentally invalidated their entirely real experiences.
To really get PMOS, we have to look under the hood at the engine driving the whole disorder: insulin resistance. Normally, insulin acts like a key, unlocking your cells so they can absorb glucose from your bloodstream. But in this condition, your tissues resist the insulin. When your cells stop responding to the key, actually, scratch that, it's more like the locks are jammed. Glucose just builds up. And in response, your pancreas goes into absolute overdrive, pumping out massive amounts of insulin to try and force those doors open.
This hyperinsulin state sets off a literal biological domino effect. Step 1, the cells resist insulin. Step 2, the pancreas overproduces it. Then, in step 3, the ovaries get totally hijacked. That elevated insulin forces them to flood the body with excess androgens, which are often called male hormones. Finally, this hormonal flood results in the visible symptoms we historically blamed entirely on the ovaries, things like irregular ovulation, acne, and excess body hair.
Because insulin resistance is the core driver here, the fallout goes way beyond fertility. We're talking about severe, long-term metabolic risks. Things like prediabetes, type 2 diabetes, obesity, non-alcoholic fatty liver disease, abnormal blood lipid levels, and even cardiovascular disease. Viewing this solely as a gynecological issue is frankly dangerous because it completely ignores these lifelong whole-body risks.
This brings us to the polyendocrine part of PMOS. And wow, does it show the true scope of the disorder. It's basically a massive communication breakdown across the body. The ovaries struggle with reproductive hormones, while the pancreas completely dysregulates insulin. At the exact same time, the adrenal glands are pumping out inappropriate amounts of androgen. Even all the way up in the brain, the pituitary and hypothalamus fail to coordinate normal endocrine signals. It is a continuous, self-feeding cycle of imbalance.
But wait, it doesn't stop at hormones. Researchers are now pointing a finger at chronic, low-grade inflammation as a major culprit too. This systemic inflammation acts like an accelerant, contributing heavily to the progression of the disease and those long-term metabolic complications we just talked about. It's just further proof that we are absolutely dealing with a whole-body issue.
Okay, we really need to bust a super harmful medical misconception right here. Body weight alone cannot define the severity of this condition. For the longest time, people just assumed this only affected overweight individuals. But the clinical data shows that people with a completely normal body mass index still experience intense insulin resistance and ovulatory dysfunction. Judging someone's health purely by their weight completely misses the hidden metabolic damage going on underneath.
So, if weight isn't the sole driver, what exactly is? Well, it's a highly complex web of influencing factors. We're looking at genetics, intricate hormonal regulation, inflammatory pathways, right alongside lifestyle and environmental influences. Because this matrix is entirely unique to every single patient, modern management absolutely requires individualized, comprehensive medical assessments, not lazy assumptions.
Section 2. The Hidden Mental Health Toll.
Up to now, we focused pretty heavily on the biology of PMOS, right? But we absolutely have to talk about the invisible burden here. The psychological impacts are profound. Consider a patient navigating severe anxiety and depression on a daily basis. Now compound that with deep emotional distress related to body image, from things like unexpected hair growth or the heavy weight of fertility struggles. Living with an unpredictable systemic disorder takes a massive toll on daily life. A truly patient-centered approach absolutely must include dedicated mental health support, right alongside the metabolic treatments.
Section 3. A new era of care. So what does all this actually mean in the real world? Swapping that C for cystic to an M for metabolic, it's a real game changer. It unlocks a completely new, holistic strategy for healthcare professionals. Instead of just temporarily managing reproductive symptoms, doctors are moving toward routine metabolic screening, cardiovascular risk assessments, and early diabetes prevention, alongside mental health evaluations and tailored lifestyle interventions. We are finally moving from reactive symptom management to a proactive, lifelong strategy designed to actually extend lives.
Which brings us to a final thought to chew on. When we stop looking at just the ovaries, and we finally treat the whole body, how many millions of lives are going to change? Recognizing PMOS as a multi-system disorder is arguably one of the most exciting shifts in modern personalized medicine, paving the way for earlier diagnoses and drastically better long-term support. Thank you so much for joining me on this explainer. I really hope this brought you the clarity you were looking for. Keep learning, and I'll catch you in the next one.